Hello, welcome everybody, and welcome back to another exciting and informative episode of Mind, Your Body, and Soul. I am Joseph Ward, and as you can see, I'm by myself today because Mathias Sweet, he's just busy everywhere. So we try to get him back when we can. So give a big shout out to Mathias when you see him and give him a hug because he's working hard out here. But remember, Mind, Your Body, and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Remember, you can catch Mind Your Body and Soul on our Neighborhood Medical Center website at www.neighborhoodmedicalcenter.org, as well as our podcast website at www.nmcpodcast.com. The audio of our the audio of our podcast are also available on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, and Google Podcasts. And of course, you can support us here on our home, which is YouTube, this Neighborhood Medical Center YouTube channel. So make sure you subscribe to the channel. Smash the like button on this video because that really helps the algorithm and help many people see us. Share this podcast and drop a comment in the description. Tell us what you think. Just say hey, whatever you need to do. So thank you to everybody for joining us. So I'm excited about this interview. This organization, in my opinion, is one of the leading organizations in the Big Bend area as far as resources. They are the resource hub. They are the hub of all hubs of resource hubs. I learned about this organization a while ago, 211 Big Bend. I learned about 211 Big Bend a while ago when I first started working into HIV/AIDS. And one of the greatest things about 211 Big Bend is I was able to lean on them as far as being able to help me help the patients that we were serving. Being able to connect our patients to resources that they need that they didn't even know existed in Tallahassee or didn't even know how to access those resources. And it was as simple as picking up the phone, calling, and asking questions. I can remember an incident where we were doing outreach. It was about 2 o'clock in the morning. We were doing outreach, and we come across a lady who needed help, and she needed help desperately. We were able to call 211 Big Bend at 2 o'clock in the morning, and resources were available. I mean, fast. And we were able to help this young lady at 2 o'clock in the morning because of these resources. So my hat goes off to 211 Big Bend. And today, representing 211 Big Bend, we have the president and CEO of 211 Big Bend, Ms. Tori Greer. Thank you for joining us.
Thank you, Joseph. And that was a great story and definitely a great segue into what it is we do. And
Yes.
so I'm excited to share more.
And just first of all, just thank you for what you do. Thank you for being a part of such an awesome organization that has continuously served the Tallahassee and the Big Bend area for a number of years. But the main thing is I'm so excited because more and more people get to learn about 211 Big Bend and they get an intimate insight on 211 Big Bend from your purview. So thank you for being here.
Thank you.
So so before we jump deep into the resources, kind of want to give people some information about yourself. So can you give us some background information about yourself and how you came to being a part of 211 Big Bend?
Okay. My name is Tori Greer. I've been with 211 Big Bend for about 5 years, and I've been in the role of president for almost 1 year.
Okay.
And I came to 211 from healthcare, actually, the Agency for Healthcare Administration. And when I learned about 211, I was so excited because I could see the missing link between health outcomes, positive health outcomes, and all of those other pieces that impact someone's health. And
Right.
that really is what brought me to 211 is I was so excited about all the resources that 211 can help connect people to. And that's why I liked your story
Okay.
when you're talking about um, connecting health with social care, and of course, mental health support and all the other things that we'll talk about.
Right.
So that is what brought me to 211. And I love our mission, and we have the most passionate and dedicated staff here 24/7, helping to support our neighbors here in the community.
Okay.
So I'm excited to share more,
Yes.
and and talk a little bit about the types of programs and services we can offer.
Okay. So let's start from a basic level. So
Yeah,
let's say for the person who has no idea about 211 Big Ben, can you give that person an overview of what 211 Big Ben is and how you guys serve the community?
sure. So 211 is a 3-digit number you can call anywhere in the state of Florida and in over 90% of the US. And 211 Big Bend covers 8 counties, including Leon and Tallahassee.
Mhm.
And we're a 24/7 support, crisis, information, and referral hotline. And so, one piece of what we do is provide information and resources. So, if somebody um, is not sure where to go for childcare assistance,
Mhm.
or needs to find a nearby food pantry, or needs transportation to get to a health appointment, they can call 211. If someone is in need of short term counseling, mental health referrals, or suicide support, they can call 211. We have 2 other ways you can get in contact with us. You can chat on our website. So if you go to 211bigbend.org, you can chat, or you can text us at 898-211 in addition to calling 211, because we know not everybody maybe feels comfortable calling. Maybe they want
Right.
to reach out a different way. So we have a lot of other special programs and services, which I'll get into, but the 211 number has been around for about 25 years. Actually, we're, I
Okay.
think, celebrating that 25-year anniversary. But 211 Big Bend has actually been around for over 50 years.
Wow.
Starting, it was part of FSU as a telephone referral and counseling service.
Okay.
And then when the 211 number was implemented in Florida, we became 211 Big Bend. So we've really been serving this community for over 50 years,
That's great.
providing information and referral and support. And so it's quite a legacy here, and it always amazes me that there's still so many people don't know about us, and that
Right.
we're here, and so that's why I'm excited that to spread the word. Um,
Yes.
yeah, so
Now, but that's exciting because I didn't know you guys have been around for 50 years, especially with the starting on FSU campus as a resource for students in mental health.
right,
And
yeah,
it expands because you still have a plethora of mental health resources available on your site. So just and getting into that, so let's and let's take the angle of either I need mental health help or I know somebody who I'm trying to get help for. I haven't been able to find any leads in the city. I've asked a couple people. They've referred me to a couple organizations, but I didn't get the exact help I needed. So I come across 211 Big Ben and I'm looking for mental health resources. What would be the best way to navigate the website or to interact with somebody um, on and at 211 Big Ben to be able to get the best resources?
so we always encourage people to call or text or chat with us. But there are resources listed on our website. Our public facing resource directory can be accessed from our website. And then we also have a separate mental health directory,
Okay.
which we update. And that includes information regarding local mental health therapists, psychiatrists, and you can filter by county, by insurance accepted, or if it's free or sliding scale, um, gender, race, ethnicity. There's a lot of filters. But the best way, I think, really is to call. We have mental health navigators on staff,
Mhm.
and they are not, they work with that mental health directory to help connect people, not just
Got
refer. but connect people with, whatever type of mental health support they need.
Right.
And so they will do follow-up calls to make sure, hey, were you able to get an appointment? And
That's
then
great.
provide, short-term counseling in between appointments, because we know a lot of people have waiting lists, and sometimes it
Hmm.
is hard to get connected. So that's one way that 211 can be a resource. And that's been with support from the city of Tallahassee and Leon County, the Mental Health Navigator program. So we're really grateful for the partnership there.
Right.
So that's one way I think, if you're looking for mental health support specifically, getting
Hmm.
connected with our mental health navigation team is a really great first step.
Now, that's awesome though that you have a navigation team. Um, One thing I've learned, especially working in healthcare or just working in as a service provider, period, is you have a lot of people who want to access services or access care, and in the process of accessing it, something could happen. Let's say they have a bad experience. Um, they encounter somebody maybe having a bad day, or they just may not be knowledgeable on how to truly access the information. So frustration can build, but having that navigator there can help them get over the hurdles, and it can lessen the barriers between that person and the resources that they're looking for.
Right. And that's a good point. And I also mentioned transportation.
Hmm.
We have a Lyft Ride United program, and it's funded
Okay.
by United Way, worldwide, and our local United Way of the Big Bend. That allows us to actually dispatch a ride for someone. So if you call us and, um, you actually need help getting to a health appointment,
Hmm.
one of our counselors can actually dispatch a ride. So it
Oh,
helps
that's
to
great.
overcome that initial barrier, which I've noticed that transportation is often a really big barrier to getting connected to services. So we want to
Right.
try to eliminate those as much as possible.
Right.
Yeah.
And
So
the following up, because how successful have you been able to, I guess, gauge the progress of the person due to the follow-ups that they're given between appointments?
So we do offer follow-ups to people who call us, and that really is a great way to um, see if they were able to get connected and see what the gaps are in our local community. Um, and we find that someone who receives a follow-up is more likely to get support. So it
Right.
may be that, oh, no, I wasn't able to get an appointment. Well, what were the barriers to getting an appointment? How can we help overcome them? Maybe we need to
Right.
do some advocacy for that person. Maybe we need to help with getting an appointment scheduled. And so we've, oh gosh, I would say almost 20% of all of our calls, receive a completed follow-up, meaning we're able to connect with the person and evaluate, assess, were they able to get connected to what they needed.
Right.
And so we're trying to focus on not just handling the incoming contacts, but doing more of that follow-up system navigation. And that also helps us with identifying what the unmet needs are in our
Hmm.
community. And there are many. There are a lot of
Right.
resources, but as you know, we are also seeing that sometimes we don't have resources,
Right.
to give people. And
Right.
so we do the best we can to work through, okay, what are the options and alternatives, and but that is a challenge.
It is. Now,
Yeah.
it definitely is. But like I say, you guys help bridge that gap even more,
Yes.
though.
Yes,
So
exactly. Yeah.
because more people are able to get services now than ever.
Right.
So
Right. I think
definitely
it's
appreciate that.
just knowing where to start, and 211 is just the very best place to start. It
Yeah,
really is. I believe that wholeheartedly.
yeah,
That's why I'm so excited about the mission, as you
right.
can tell.
Yes, yes, and
So,
but also on our ends to make sure that we tell as many people as possible about 211 Big Ben,
right.
saying until we're blue in the face. So,
Oh,
um,
we appreciate that.
oh, no problem. But in addition to the mental health, because I'm on the website as well, and I love looking through the website. But the 988 suicide and crisis lifeline,
Yes.
and I'm sure that line helps, especially in a city in an area like this.
So you're right. You're absolutely right. So the National Suicide Prevention Lifeline just went through a rebranding. So that's a
Hmm.
national toll-free number, and so they went through a rebranding and now have a new three-digit number similar to 211. It's 988, and it's specific to suicide prevention. 211 Big Ben, like many other 211s in the state, has been a lifeline provider for many years. So this is just kind of a new way of accessing the suicide prevention hotline.
Hmm.
Um, but all of our counselors are trained to answer 211 and the 988 lifeline.
Okay.
So the training is very similar. So you could be in a suicide crisis and call 211 or 988 here locally, and you'll get connected to a trained counselor at our center. Um, so we've seen an increase, just looking by comparison from last year to this year, over 40% increase in calls to
Hmm.
Lifeline. Um, the other thing I want to mention is that our calls are longer too, which shows that people are really struggling.
Yeah.
They're needing more emotional support, not just they may not be in a crisis, um, but that's, I think there's more awareness of 211 and 988 now, and that's so more people are calling, which is a good thing. That's the very best thing you can do for yourself is to call.
Right.
Um, so it can be a little confusing because you're talking about two three-digit numbers, but if I were to try to summarize the difference, I would, 988 is a national number focused on suicide and mental
Hmm.
health crisis. 211 here locally is also suicide and mental health crisis with an emphasis on local resources and support
Right.
and referrals to local mental health and community resources. So
Right.
that's kind of the distinction there.
Gotcha. But
Yeah.
I but in hearing that though, when you say 988, I think about emergency because the nine
Yes.
it's the three digit, it's the nine. So I know
Yeah.
a lot of people will remember 988.
Right.
It's similar to 911, but
Yeah.
also still sticking with the three digit theme, 988 211 911. So knowing I have these three numbers in my back pocket that I could use whenever an emergency or a crisis has occurred. And because I get what you're saying, the distinguishing between the national number and the local number. And as we go out more to the local streets, reminding people that 211 is for the local line, but you can call 988, and so both can help.
Yes.
So
Yes. Yeah. Um, that's correct.
yeah.
And with looking at through all three numbers, 911 of course is for emergencies, but we've had the question, well, what happens when you call 988 and
Hmm.
you are in a suicide crisis? Is law enforcement contacted? I just Less than 1% of all calls involve emergency support. And what that
Hmm.
shows is that it really works to call and that
Right.
we're able often to de escalate people or maybe have a mobile response team
Hmm.
intervene when needed. And so that's the very best thing you can do for yourself is to
Right.
call. Yeah.
Right. And
So,
in addition to that, there are and I'm not going to say this across the board because I don't want to just speak for somebody else's agencies, but I've talked to law enforcement in the past who've talked about giving specific officers extra training in mental health and dealing with
right.
suicide and dealing with these crises. So they're the ones who are deployed out and not just an officer who may not have the training, but they're
Right.
actually making strides in um, partnering up with organizations like yourself and the other mental health organizations and making sure that officers have the extra training. So if they go out, they can de-escalate rather than the situation goes worse.
Right. That's exactly right.
Yeah,
Yeah.
cool.
Yeah.
So, but that lets you know the resources are working.
Yes. Yeah. And Appalachia Centers has mobile response teams as
Hmm.
well, and we've utilized them in cases where somebody's called us, but they really want somebody to come to them and help them through the crisis. And so they've been great partners,
Right.
and dealing with crisis calls as well.
Right.
Yeah.
Right.
So
And just let our viewing audience know that we put all three numbers, especially the 988 and 211. It's in the description, so you can't miss it. Check the description.
and if you do go to the website, there is a 988 page, and there's a good graphic that kind of
Hmm.
defines the differences and goes over a little more about what
Yep.
988 is, and so that's a good
Yep.
resource too.
Yeah, and it's right at
Yeah,
the top. It says about 988.
about 988. Yep.
Yeah. And so, okay, so now we're going to venture more into my realm, the HIV/AIDS prevention realm, because I see
Yes.
you guys, and see we get excited about it because that's another ally for us. But you guys have a Florida HIV/AIDS page and a Florida HIV/AIDS hotline. So could you tell us more about the hotline?
Yes, so that is a toll-free number. That's statewide hotline
Okay.
actually, and it's funded through the Florida Department of Health, and we've had that line for I think about 30 years. So we've been the provider for since the
Wow.
implementation of that line. And if you go to our website, there is a page on
Hmm.
the Florida HIV/AIDS hotline. But any questions about HIV, STDs, information, resources, that's the line to call. Of course, there's some overlap with 211. You can call 211 and about the same types of questions, and you'll get
Hmm.
connected. But the difference here is this is a statewide toll-free number that's heavily promoted by Department of Health and is a really great resources for any questions. There's also a separate statewide database that we manage of HIV/AIDS specific resources
Okay.
as well. Um, and there's several lines. We've got 3 bilingual counselors, and we also have translation services available. So whether if you're here locally and you speak a language other than English, there's resource there for you. And there's also text available, so you can text FLHIV to 898-211.
Okay.
And again, that's a statewide toll-free number.
Right.
So
Right. But what I'm looking at it, and what I love about it is the access to the information that they have,
right.
especially um, looking at giving people information about what PrEP is, what PEP is. If
Yes.
you're new, especially newly diagnosed with HIV, because that is a critical point in a person's life when you find out you have HIV, and the step is all right. Well, what next? And to
Right.
be able to provide that what next is critical in keeping them in the care.
Yes. And our counselors are often we're getting calls where someone is they're scared, they're terrified, they don't know what's next, maybe they're feeling shame. And our counselors are often able to get them to a point where they know there's resources out there, there's available for me, and this is something that I can live with, and it's just it can be empowering. And
Yes.
so the best thing you can do is to call. And um, so the information part is really important. There's just so much information out there that I think people don't know about. And that's one piece of what we do with this line is we're able to give them information, help get them connected to whatever treatment is needed for their particular situation.
Right.
Yeah.
And there's two other things I love about that whole page. One, the financial assistance for Floridians with HIV and/or AIDS.
Right.
And the first thing we see is the ADAP program,
ADAP.
the
Yeah.
AIDS Drug Assistance Program. And I've worked in HIV/AIDS prevention for 13 years, and I can't tell you how critical that program is. It's helped so many people who haven't been able to pay for their medicines, be able to get medicines and get treatment and care. And these people are still alive because access to this. So the fact that you guys have information about the ADAP program or just accessing financial assistance, period, for people with HIV/AIDS, that is awesome, and that's another reason why you guys are such a great organization, just such a great resource, um, just a resource hub, because you're not just scratching the surface; you're actually giving people in-depth information,
Right,
and
right.
then you transition into STD information. So that's great for me.
Yes. Yeah. And so when someone starts as a volunteer or a paid counselor, the very first training they do is 211 and 988. Like you have to be trained there. But then the next phase is training on the HIV/AIDS hotline,
Hmm.
and they go through um, a very lengthy, robust, comprehensive training so that they're prepared to answer these types of calls. And not only that, there's continuing education throughout the year on any updates related to resources for those with HIV/AIDS or STD concerns.
Oh, that's good.
So I'm really excited about the the staff we have are just really great at um, staying current on what the latest resources are so that all of the counselors have the most current information to share with people who call us.
Right.
Um, so our page, I, I'm looking at it now. There's just so much information
Hmm.
there, and obviously we can give that over the phone, but you can also go to the website
Yeah.
and learn a lot
Yeah.
just from visiting. So
But it's the different options as well, though. Um, I know people who will only call. I know myself, I probably would access the website first and then call. But then you have the text option as well. That
right,
would, for me, that would probably be my last option, because I would prefer to pick up the phone and call to talk to somebody. But you have the options available for um, different ways people like to communicate, and
right.
different ways that people have access to communicate as well. So
Right, that's exactly correct. And web chat, there is a link
okay,
right under the 800 Florida HIV/AIDS number.
right,
There's a start chat link, and if you click on that, it'll open
right,
up a chat box, and then you can
right,
start
and that's good.
having. And it's all confidential. That's I don't think I mentioned that at the very beginning, but we are an anonymous confidential hotline. There's only the confidentiality. Um, there's only a couple cases where, and it would have to do with like when we're legally required to report
Hmm.
abuse.
Right,
That's an example.
right,
But in all other cases, when you're calling and you're talking with someone on our team, you are anonymous, and only with a caller's consent would we share information
right.
in order to maybe better connect someone with resources. In that case, that's when we would collect that person's consent and contact information. So you
Gotcha.
can feel good about if you're feeling like, oh, I'm not sure if I want to call a crisis line. I don't, you you can know that that we take confidentiality really
Hmm.
seriously, and that is embedded in everything we do.
Right. Okay.
Yeah.
So I'm also seeing that under the Get Involved tab, um,
Yes.
we have we can stay up to date on you guys' events, but how to a volunteer option. So how does one become a volunteer with 211 Big Man?
The very first step is to complete an application, and so we do the training 3 times a year, um, fall, spring, summer. It kind of aligns with college semesters. The majority
Gotcha.
of our volunteers happen to be college
Right.
students or grad students, um, but we would really like to recruit more community members as well.
Hmm.
So it's a 3-month training, and so the first step is to you can attend an information session. Generally, we'll do a few of those at the right before the start of the training. You fill out an application, you submit it to the volunteer coordinator, and then an interview is scheduled. And at that point, We usually will take 25 to 30 applicants. We like to keep the class manageable. Um, but that's really the process is you fill out an application, references, and then there's an interview to see if you're a good fit. And a lot of the interview questions involve kind of evaluating, you know, do you have empathy for others? Like it's not, you don't have
Right.
to have a mental health background, though most of our volunteers do, that they
Hmm.
are usually studying, usually pursuing a master's in social work or
Right. Okay.
going into psychology or something like that, because it does align with those interests, but it's not required to be good at this. And that's important to remember that if you're interested in volunteering, um, don't let that prevent you from reaching out.
Right.
So, and we do, I think I mentioned we've got, I've not gotten into some of our special programs, but we have veterans on our staff as well. And so we're also looking to have more veterans on our in our volunteer pool as well, because we really appreciate um, different backgrounds and the perspectives that that can bring to the job
Right.
of answering calls and helping to connect people.
Okay.
So,
But with that being said, what are some of your special programs?
so um, I mentioned veterans. We've got
Yes.
a My Florida Vet program, and that's part of a statewide project. But we've got uh, uh, 3 veterans on staff who they're trained hotline counselors, but they do a little more than that. They actually provide peer support to veterans.
Hmm.
So when a veteran calls us, they may not want to speak to just anyone. They will likely want to speak to somebody who's been in their shoes. They may be hesitant to reach out for help. And talking to a veteran can help overcome some of those
Right.
challenges. So we partner with the Veterans Legal Collaborative, and you'll find our veteran staff at the legal clinics. There's one that happens at the American Legion near Lake
Hmm.
Ella. And
Hmm.
so they actually do some face-to-face support as well as answering calls. Um, so, so we have that team on staff that provides added care coordination and support to our veterans and their family members as well. Um, so that's one of our special programs, and we have Help Me Grow.
Hmm.
That serves children 0 to 5. Um, we've got Help Me Grow care coordinators that will do developmental screenings to assess if there may be a developmental issue, and then they connect them to whatever the appropriate medical intervention is. So if you call 211 and maybe the counselor hears, "Oh, you have a 2-year old. Would you be interested in a Help Me Grow follow up?"
Right.
And that's
Okay.
one way we can help catch catch people from maybe falling through the cracks. Maybe a caregiver or a parent is not aware of those resources, and so Help Me Grow is a really great program to kind of help connect children and families
That's
to
good.
those types of resources. I know I have a 3-year-old, and um, you know, I realized even when we go to the her pediatrician, we don't always talk about all of the developmental milestones.
Yeah.
I mean,
Yeah.
there were questions I didn't know to ask,
Right.
and
Right.
I'm not alone in that.
Right.
And Help Me Grow really, I've used those screenings for my 3-year-old to assess, is she where she needs to be? Are these questions I need to ask the doctor? So that's a really great program.
Yeah.
So we work with Early Learning
Right.
Coalition and Whole Child and some of those agencies as well.
And that's
Um,
great.
yeah. So, and I mentioned mental health navigation
Hmm.
and Lyft
Yes.
transportation. Um, and then we talked about our statewide hotlines, HIV/AIDS hotline, but there's also a family health line, which is another toll-free number that's statewide, and that deals with infant and toddler questions and maternal
Hmm.
mental health as well.
Okay.
So those are again kind of separate from our
Right.
local 211 programs and
Right.
services.
Because it's just
Um,
additional services, though.
yeah.
Yeah.
So I think that's something I think we do really well at 211 is, we're not just this access point, but we really can help. We also have some special programs that
Right.
can further help people. And it just works well for kind of blending all of those together under 211.
Gotcha.
So yeah.
And you guys also have the ALICE program, the Asset Limited Income Constraint Employed.
Yes. So United Way, you probably hear that a lot with United Way. They've got the Alice report, and
Okay.
the local United Way of the Big Bend has talked a lot about the people who are who are over the federal poverty level, but still one financial crisis away from
Right.
becoming unhoused, or and that's probably over half of Florida at this point. So we've got staff, and really all of our staff are trained to do this, but we have one person in particular that's a community navigator, and again, just the same goal of trying to help connect people. And we've got some additional banking resources available. We've worked with credit unions that have some products that are available for people who may not be a good match for other types of banking solutions. And so that's been a less popular program, but it's there.
Right. Right.
And we also help with employment. We have a good, referral relationship with Career Source, and so it's also just trying to catch those people as well.
Right.
So that's
Right.
what is referred to by ALICE, Asset Limited Income Constrained Employed,
Gotcha.
which is a lot of us. I
Yes.
mean, that's it's interesting to think about that group, because it's such a large percentage. It's a growing percentage of people.
It is. It
I
is.
mean,
But
we're all kind of could be one crisis away
right.
from, and
Right.
so I think it's an important acronym
Yes.
to
Yes.
know and discuss.
But it's also like you stated earlier. Those of us who may work for the various service providers understand that we can access those resources as well.
Right,
Um,
exactly.
we don't have all the answers, and there are realms where we are not experts in. So you're talking about taking your daughter to the doctor and being able to access the services that were available, so you can learn more to ask the specific questions. I know we have a presentation that we put together, making the most of your healthcare visit. What I like about doing that presentation is it reminds me of what to do when I go to the doctor myself.
Right.
Like,
Yeah.
plan to go to the doctor, make a list, do the things that you need to do. But we teach it to other people all the time, but it's a reminder to ourselves that we need to access these resources as well. So yeah,
Okay,
I'm
I
happy.
would like a copy of that presentation. I think that would be good to share with
Yes.
my staff here, and because we're so focused on taking care of other people,
Right. Yeah.
you know, got
Yeah,
to
we definitely share it
think of,
with you.
yeah, yeah.
Yeah, so that's no problem. So and I also love the disaster preparedness and the diabetes management, but just the fact that you have um, resources that people would think about and resources that people may not think about, things that may not be at the top of people's minds. Because as once again, the service providers, we understand that something may be important and a priority to us because we work in it, but the people that we're serving, it may not be their priority at the time. So any other things that we can help them deal with that can make their health a priority, or even rebuilding their lives a priority, that's where we can really come in and be an asset to them. So you all having all these services can really help a person get on their feet and even strive in life. Yeah.
Yeah, the disaster preparedness, we have a a role to play there, and we're part of COAD and some
Mhm.
of the local emergency response efforts. But we're also just heavily promoted, during times, during the pandemic, but then
Yeah.
also when we've had, like during Hurricane Michael, as an example, our call
Yeah.
volume tripled, and we were backing our neighbors up, our 211 neighbors in
Mhm.
Escambia up as well. Um, and people are often calling maybe for information about, okay, where do I am I in an evacuation zone or something, but also my power went out, I lost all my food
Right.
and I can't afford to buy any more food, or and we got a lot of calls like that.
Right.
And so during times of emergencies, we also have a pretty significant role to play. We're also often giving data to our local emergency response team about, okay, the types of caller needs we're seeing during a disaster, and so that page, the disaster preparedness page, we rolled that out actually during Hurricane Ian. And
Hmm.
I think it has some great resources
Yeah.
there. And of course, connections to um, the city of Tallahassee emergency pages as well.
Right.
And the prep guide, all of that is really great to have, um, in your back pocket. We're
Exactly.
not through with hurricane season yet, so
Not at
we still
all.
want to want to make sure we're prepared.
Yeah.
So I'm glad you mentioned the disaster preparedness, because sometimes I forget to mention that, but it's a key part of what we do. So
Yeah. But no, I mean, hey, like I said, you guys have access to a lot of resources, and so that's why you put it on the website, to help people access it. It's kind of hard to remember everything, but you have a good grip on a good number of the services that you guys provide. So that's amazing. So so with that being said, what's the best way someone can access you, or what for well, let's say it this way, what's your what's the 211 Big Ben website, and what's the best way for people to reiterate once again the best way for people to access and be able to communicate with someone from 211 Big Ben?
so our website is www.211bigben.org. And that's a great place to start um, if you have access, web access,
Mhm.
and then uh, from there, you can call 211 or 850-617-6333. That's our 10-digit number for 211. So um, you can text 898-211. It'll ask for your zip code.
Mhm.
Um, and then going back to the website, if you're on our website, you can chat with us. And there's a couple pages, Helpline 211 page under Get Help. That's where the link is to start the chat. It's
Yeah.
kind of a small button underneath Call 211, but if you click on it, a box will come up and you can start a chat.
Yeah.
Um, so, so those are probably the three best ways. There's also under Contact, if you want to generate kind of an email to us. If you go there, um, you can fill out a form and it'll generate an email, which will be routed to the right person. So, um, best way, of course, we always say 211, call
Yeah.
211, but there are other ways as well.
Yeah. Now,
Yeah.
definitely appreciate you. All my audience, access these resources. And if you don't need them, make sure you share this information with other people so they can access the resources, because we all know people within our community who need help and who are doing their best to access resources but may not have the information on knowing where to start. So this is a great resource, great piece of information to give them, because it's the actual resource hub for our Big Bend area, where, if you're talking to individuals and the individuals may not know, well, 211 Big Bend, it's a great chance that they know. So, Tori Greer, y'all give it up for the awesome Tori Greer. And and thank
Thank
you,
you.
just thank you, because like I say once again, I just think you guys are so important in our community, and I want to make sure that Neighborhood Medical Center was a part of helping you guys and partnering with you guys and helping getting the information out. And definitely look forward to partnering with you guys in the future for events within the community, because we do a lot, and I know you guys do a lot, so we can merge and meet somewhere.
Yes, I would love that. We need to do
Yes.
more of that.
Yes,
Absolutely.
yes, 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 yes. So, um, You guys, once again, all of the contact information for 211 Big Ben is in the description. So go to the description, access the information, access the resources, tell a friend to tell a friend to tell a friend. And while you at it, make sure you like this video so as many people as possible can see this information. So once again, I am Joseph Ward. She is Tori Greer. This is Mind Your Body and Soul, and Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Remember, our website is www.nmcpodcast.com. Our parent website is www.neighborhoodmedicalcenter.org. Our audio for the podcast is available on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, and Google Podcasts. And remember here, like, comment, subscribe, and share. See you guys next time.
Thank you.